So what is the conventional, why is conventional medicine not able to treat skin issues like eczema, acne, psoriasis? And what is it that they perceive it to be the actual problem versus what is the functional medicine? What is your approach and what has been your experience?
Right. So I think a conventional, like I said, designed to give you a short-term answer, give you a shortcut. You have a problem, it's painful, and it's emergency, they'll give you something. Okay. In case of eczema, they'll give you steroids, either local application, and as it becomes more severe, probably oral drugs. Probably then if they can move you into immune suppressants or some other drugs. At the end of the day, there is no attempt to find out why it is happening. Okay, any disease is always a multifactorial problem, not just one reason behind the problem. Multiple issues are happening in the system, which is triggering as a manifestation and leading to a diagnosis. Okay, now conventionally we have a diagnosis and we just want to treat the diagnosis with the drugs. We don't want to see what is the story behind it. Now, in our experience, like I said, food triggers is a big problem, high sugar diets is a big problem, processed foods is a big problem. Now you asked me a question that number of patients are increasing with eczema, and why is it happening? If we really look at it, human genome has not changed in the last 50 years, 100 years, but certainly you can recognize that lifestyle and food and kind of environment we are living in has drastically changed. Okay, so there's no change in the genes, there's a huge change in the environment. So that is the epigenetics which is triggering the manifestation. So if we fix the epigenetics, which is a lifestyle, food, diet, etc., eczema is the simplest to fix it. It's not difficult at all. And in case you're a parent with a child with eczema, please don't let them suffer with the pain.
So what you're saying is basically the root causes of eczema or skin issues have not been understood in conventional medicine.
Absolutely.
So they are basically just treating the superficial level at the skin level. But as per your treatment protocol, you're going to be going to the root causes, which will be as simple as looking at the gut, looking at the inflammation in the body, looking at heavy metal toxicity, right? So if you could just elaborate more around what sort of protocol do you follow to cure people of eczema, whether it takes 6 months, 9 months?
Right, so eczema is much simpler than psoriasis. Eczema, probably 3 months skin can clear off. Yes, root cause might take more time for elimination, but as a manifestation, 3 months is good enough. Okay, 2 months or 3 months is good enough, as long as you are willing to follow the recommendations. Okay, like I said, there could be food triggers, there could be a lot of infections in the gut, in the body, there could be a lot of toxicities in the body. Some of these things we can test, some of the things we have to just look at the metabolism and assume that some of the things are not happening right, and accordingly you have to take those actions. And a lot of time, now this is a little controversial issue, but we know for a fact that number of vaccines we are taking today is increasing, and vaccines can make the immune system more specific. Okay, the non-specificity of the immune system is sometimes required for us to check these infections which we commonly get exposed to. When we take a lot of vaccines, our immune system become more specific. As a consequence, our fight against the common things that we should be fighting is becoming weak. As a consequence, we develop more autoimmune problems, and infections like fungal infections like Clostridia, they stay in the body. Infections like viral infection, they stay in the body and continuously keep troubling us. So if we work on these situations, you will see that it's taken care.
And what is the holistic approach? If you can give a guideline around the 10 or 12 dimensions that you work on. So what can a patient or what can a member foresee in their program? Right. What all will they be asked to do?
Right. So it's very, very simple. Okay, you just has to do what we would have done 60-80 years back, as close to as nature. Okay, now very, very simple. If our immune system has to be healthy, which can control our eczema, or immune system which is not doing a self damage, it has to have a right metabolic trigger. Which is the metabolic trigger? Is the sunlight. Make sure you get enough sunlight, and don't overexpose yourself to the blue lights. Artificial blue lights can be a problem, especially after sunset. Okay, get more sunlight in the day, After evening, don't be under overexposure of artificial light, and sleep at right time. This is very, very important. Sleeping at the right time allows the body to repair. Second, of course, a very, very crucial component is you make sure that you're drinking good quality water, which will help you hydrate your cells, make your immune system better, take the nutrition in, take the toxins out. Third, of course, we have to eliminate sugars. We have to eliminate very, very sweet fruits like bananas and oranges, which otherwise are healthy, but for you or your child who has eczema or psoriasis, maybe these are not right choices until the problem is taken out. Then white rice is also a bad choice, gluten is a bad choice, dairy products is a bad choice. Till you are off eczema or your child is off eczema, you want to eliminate them. Then of course we have to look at the infections by running the test and find out which specific infection, and sequentially we have to clean them. If parasites are there, fungal is there, viral infections are there, bacterial infections are there, and sequentially we have to clean them out and reinstall healthy microbes and modulate the gut microbiota. Next, of course, we have to test thoroughly which toxins are present in the system, primarily heavy metals. Then step by step, gradually we want to clean them out. Then if mitochondrial deficiencies are there, mitochondria is not so functional or some things are triggering the problem, we have to ensure that metabolic function is going up so that immune system keeps well, so that it helps you repair better. Then nutrition is very, very important. A lot of time, even though we are eating the best of the food, okay, we are not digesting it. When you don't digest it, food doesn't become you, rather it becomes a food to the infections. So it is important that you digest. If required, you take some digestive enzymes. Now at the same time, even though you are taking nutritional food, but if it's not becoming part of you, your body is nutritionally deficit. As a consequence, your immune system is weak. As a consequence, the problem can be there. So we can supplement what all is missing to speed up the recovery. Okay, so these are some of the things we would typically look around and see which is your trigger, and accordingly will help you.